"Doc, I didn't know I was hurting myself." That's what a 74-year-old man told me, voice trembling not from illness, but from shame. For decades, he'd done what millions of men do in silence, masturbated the same way he always had. But no one ever told him that after 60 your body changes, and so must your habits. I'm Dr. Edward Blake, a urologist who's spent over 30 years helping men over 60 preserve their strength, confidence, and intimacy without shame or guesswork. The truth, masturbation can still be healthy, but only if you do it right. What used to feel good can now damage your prostate, your nerves, even your heart. In this video, I'll reveal 5 masturbation secrets for older men, truths that can transform how you age, feel, and connect to your body again. And if you think this is just about sex, think again. It's about identity. It's about healing. So don't click away, because the next 10 minutes might just change how you live the rest of your life. Secret 1. Erection isn't everything. And that's okay, Doc. Does this mean I'm not a man anymore? Those were the words of a 72-year-old patient, tough guy, retired Army, 3 kids. But in that moment sitting in my office, his voice cracked. He couldn't maintain an erection the way he used to, and he thought it meant he was broken. Washed up. Done. Let me be clear, this is one of the biggest and most damaging lies older men are told. We grow up in a culture that links manhood to performance, stamina, firmness, the ability to get it up on demand. We're taught to measure ourselves by how hard, how long, how often. But after 60, the rules change, and no one ever gives us the new playbook. You see, aging isn't failure, it's evolution. Your body is shifting. Testosterone dips, blood flow slows, nerve sensitivity changes. These are biological facts, not signs of weakness, but signs of time. And the most important truth I can give you is this: your erection is no longer the whole story. And it doesn't have to be. When you're younger, an erection is automatic. The wind blows the right way, and boom, it happens. But after 60, you need to be more intentional, more patient, more present. And that's not a downgrade, it's a doorway. Because something incredible happens when you stop chasing performance and start exploring presence. I've worked with men who were ready to give up on intimacy entirely because they couldn't get it up like before. But when I showed them that they could still feel, still connect, still experience pleasure even without a full erection, something clicked. They stopped measuring themselves by what they lost and started rediscovering what they still had. You see, physical intimacy doesn't begin and end with the penis. Your body is full of erogenous zones. Your breath, your hands, your voice, these can all become powerful tools for connection. And when you let go of the pressure to perform, your nervous system relaxes. You're no longer in a battle with your body, you're in partnership with it. That's when the real magic starts. You may not climax the way you did at 25, but you can feel deeper, connect more honestly, explore emotional closeness that's richer than anything you've felt in years. Why? Because you're no longer performing for someone else's scoreboard. You're showing up fully present, fully alive for yourself. I once had a patient, Howard, 68, who told me something that stuck with me. He said, "I realized my wife didn't miss the sex. She missed me, the real me, the version that wasn't trying to impress or perform, but the one who just wanted to be close." That's the shift. That's the healing. That's the kind of intimacy that can actually get better with age, not worse. So if you've been quietly measuring your worth by what your body can or can't do, please stop. You are not broken. You are not failing. You're changing. And it's time to change the way you relate to yourself. Because when you do, you stop feeling ashamed. You start feeling free. This isn't the end of your sexuality, it's the beginning of something more grounded, more meaningful, and more human. And once you stop defining pleasure by performance, you'll start reclaiming it as presence, connection, and confidence at any age. But this secret is only the beginning. Because in the next section, I'll show you why masturbation in your 60s and beyond isn't just physical, it's emotional and neurological. And the way you touch yourself might be the key to unlocking a much deeper truth about how your brain, body, and emotions work together in older age. Stay with me. What comes next may surprise you. Secret 2. Masturbation is emotional, not just physical. A few months ago, I sat with a man named Howard. He was 76, a retired veteran, and he came into my office not for a medical emergency, but for something harder to explain. "I don't feel anything anymore," he said. "Not just sexually, just nothing." That sentence hit me hard because I've heard it before, and I know what it means. At first, Howard thought his problem was physical. He assumed age had just taken its toll. But the more we talked, the more I saw the truth. He wasn't masturbating because of desire. He was doing it every night almost automatically to fall asleep, to calm down, to escape. And slowly, without even realizing it, he had lost the ability to feel. Not because his body didn't work, but because his emotions were never invited into the picture. You see, this is the part no one tells men, especially older men. Masturbation isn't just about sex. It's about memory emotion and the quiet way we stay connected to ourselves. From the outside, it looks purely physical. But biologically and neurologically, it's anything but. During orgasm, your body releases a chemical cocktail: dopamine, oxytocin, serotonin. These regulate your mood, reduce stress, improve sleep. They're not just pleasure chemicals, they're healing chemicals. For men who live alone, widowed, divorced, or simply isolated, this small act of self-touch becomes a critical way to feel something real, a way to stay grounded, to remind the nervous system you're alive, you're still here. But when it's done without awareness, something dangerous can happen. That's what happened to Howard. The act became routine. His body was going through the motions, but his heart wasn't in it. It was like listening to a beautiful song on mute. And this is the risk. When masturbation becomes automatic, it stops being intimate. When it's disconnected, it becomes numbing instead of nourishing. Most men don't realize it, but the act of self-touch can carry decades of unspoken emotion: grief, loneliness, stress, even shame. Especially for men raised in a generation where vulnerability was never welcome, where the only safe place to let go was behind closed doors. So when they masturbate without presence, they're not just missing out on pleasure, they're missing out on emotional release. That's why I tell my patients, don't stop touching yourself, just stop doing it mindlessly. If you're using it to avoid emotion, it can silently drain your vitality. But if you approach it with intention, with breath presence, and respect, it can become something powerful. An act of reconnection, a form of emotional clarity, a tool for healing. You might be surprised how much more you can feel physically and emotionally when you slow down, when you're not chasing climax but inviting connection, when you're not rushing through the act but listening to your body's language. And yes, this still matters at 60, 70, even 80. Because the older you get, the more critical your emotional well-being becomes. Your heart, your sleep, your blood pressure, everything is tied to your nervous system. And self-touch, when done consciously, nourishes that system in a deep and lasting way. Howard didn't need a pill. He needed permission to feel again. And slowly, with presence and intention, he got there. He stopped seeing masturbation as a shameful relic of his youth, and started seeing it as a gentle act of self-respect. And that's the message I want every older man to hear. You are still allowed to feel. You are still allowed to touch. And you are still allowed to care about what brings you peace. This isn't about lust. It's about staying connected to the part of you that still wants to live. In the next section, we're going to talk about what happens when that connection disappears entirely. Because while mindless masturbation can numb you, stopping altogether can be just as dangerous. Stay with me. This next secret might change how you think about aging, touch, and vitality forever. Secret 3. Use it or lose it is real. A man named Roy sat across from me wringing his hands. He was 74, widowed, And after more than a decade of grieving, he had finally met someone new. A woman he cared for. A second chance at connection. At life. But instead of excitement, Roy felt fear. "Doctor," he said, eyes lowered. "My body doesn't work anymore. I finally found someone, and I'm broken." He wasn't. But like so many men in his position, Roy had no idea what was really happening inside his body. Here's the truth. No one ever told him. No one tells most men. Sexual function isn't just about age. It's about activity. Your penis is not just a symbol, it's a system, one that relies on blood flow, nerve, sensitivity, tissue, elasticity, and consistent engagement to stay healthy. When that system isn't used, when it's ignored, neglected, or thought of as done, it doesn't just pause. It begins to shut down. Just like your muscles shrink without exercise. Just like your memory fades without mental stimulation. Your sexual system atrophies without regular use. It's the principle we call use it or lose it. And for older men, this isn't a theory, it's biology. Roy hadn't touched himself in years. Not because he didn't want to, but because he thought it no longer mattered. He believed intimacy belonged to the past. He thought desire had an expiration date. But deep inside his body had been adapting to that neglect. Blood flow had slowed. Tissues had lost elasticity. Nerve endings had dulled. And no one had warned him. Not one doctor, not one wellness article, not even his friends, because most men suffer this in silence, thinking they're the only ones. This is why so many older men mistake disuse for dysfunction. They think something's broken. They panic. They assume it's too late. But the truth is, it's not broken. It's just been idle, and it can be reawakened. When I explained this to Roy, he was shocked. "You mean, it can come back?" "Absolutely." And here's what happened. With gentle, consistent stimulation, no pressure, no rush, just awareness. His sensation began to return. Slowly at first, then steadily. His confidence rose. His anxiety lowered. He felt alive again. Because when you show up for your body, it remembers how to respond. This isn't about chasing your 25-year-old self. It's not about performance or proving anything. It's about maintenance, about circulation, about reminding your body that this part of you still matters. Regular mindful masturbation in older age supports vascular health by keeping blood vessels responsive, maintains nerve sensitivity, encourages tissue elasticity, prevents internal stagnation, especially in the prostate signals to your brain that you are still sexually alive. It's a full body signal of vitality, and the body listens. And yet, most men are never told. They're told to move on, let it go, or that it's normal to lose function. That mindset is not just outdated, it's harmful. Because aging doesn't mean disconnecting. It means adapting. And adapting means engaging in ways that honor where your body is now, not where it used to be. Roy didn't need a prescription. He needed permission to reconnect with himself. To stop thinking his sexuality was something he had to outgrow. To understand that sexual health is not a luxury, it's a basic part of well-being. So here's the takeaway. If you don't use it, your body will assume you don't need it. But if you do, gently, consistently, mindfully, your body will show up for you. It's not too late. You're not too old. You're not broken. You're just waiting to be remembered. Coming up next, we'll dive into a secret that could explain why, even when you do stay active, something still feels off. A hidden habit that's quietly reshaping how your brain and body respond to intimacy. Secret 4. Pornography may be dulling your senses without you even realizing it. Stay with me, this one's important. Secret 4: porn rewires the aging brain. It started with one man. His name was Ernest. A 68-year-old widower, quiet, polite, and on the surface doing just fine. But when he sat in my office, his voice cracked. "I still touch myself," he said, "but I feel nothing. Not really. Not like before." He wasn't talking about erectile dysfunction. He was talking about something deeper, a disconnection, from his body, from sensation, from emotion. And as we talked, something became very clear. He wasn't broken. His brain had been rewired. You see, Ernest had developed a nightly ritual. He wasn't dating. He wasn't lonely, not exactly. He was just watching porn. Every night. Harmless, right? That's what he thought. Until the real world stopped feeling real. Here's what most men don't realize. As we age, our brains become less flexible. The neuroplasticity, the brain's ability to adapt and reset, slows down. So when you repeat a stimulus over and over, especially something as powerful as pornography, your brain starts to prioritize that stimulus above all others. It's called dopamine conditioning. Porn delivers a fast, intense, artificial flood of dopamine. High novelty, high stimulation, high reward. Your brain loves it. So it adapts to it, and eventually it stops responding to anything else. Real touch, too slow, too subtle. Emotional connection, too complex. Your brain over time learns to crave the screen, not the skin. That's what happened to Ernest. He didn't know that his nightly routine was slowly dulling his senses. His body still wanted to feel. But his brain had stopped letting it happen because it had learned to respond only to artificial extremes. He described it like being in a room with the lights on, but no windows. Bright, stimulating, but suffocating. This is why so many older men say, "I'm touching myself, but I feel numb. I can get aroused, but only when I watch something intense. I don't feel emotionally present anymore." It's not that you've aged out of desire. It's that your reward system has been hijacked. And the scary part, you don't notice it right away. The shift is slow. Years of repetition. It feels like comfort until you realize it's isolation. So how do you fix it? Not through shame, not through judgment, but through resetting the brain. That's what Ernest and I worked on. We didn't say, stop everything overnight. We said, replace, rebuild, reconnect. He began small, taking breaks from screen-based arousal, practicing mindful touch without visual stimulation, relearning the rhythm of his breath, his heartbeat, his own presence, and slowly, the numbness faded. The sensation returned. His imagination came back to life. He felt human again. This isn't about moral purity or quitting porn forever. It's about understanding what's at stake. Your brain, the most powerful sexual organ in your body, is training itself every day. And if the only thing it's being fed is hyper-intense artificial content, then yes, real life will feel dull by comparison. Real intimacy will feel flat. Real arousal will feel distant. But it doesn't have to be that way. When you step back, when you give your brain a chance to reset, you rediscover what you've lost. The sensitivity of your skin, the thrill of connection, the power of imagination, the quiet strength of presence. And more than that, you get your choice back. You get to decide how you feel, what excites you, what connects you. Because in the end, porn isn't evil, but passively giving it control of your arousal, your mood, your identity. That's a high price to pay for a few moments of stimulation. So here's the truth. If you've been feeling numb, distant, or disconnected, it might not be you. It might be the pattern. And patterns can be changed. Just like Ernest, you can take back the reins. Not all at once, but one breath, one touch, one reconnection at a time. Coming up next, the final truth. Secret 5. Masturbation can be a lifeline, not a liability. And this one may be the most important of all. Secret 5. Masturbation can be a lifeline. It was the final 5 minutes of a routine checkup when Walter, a 75-year-old retired teacher recently widowed, shifted uncomfortably in his seat. He looked up, hesitated, and finally asked me a question. "I've heard more times than I can count, doctor. Is it still okay to touch myself at this age?" The room fell silent for a moment, not because of the question, but because of the weight behind it, a mix of shame, fear, and quiet longing. Walter wasn't asking about sex. He was asking for permission to feel human again. In a world that often tells older men to fade into the background, to shrink their desires, To trade vitality for silence, this question matters more than ever, because the truth is simple, powerful, and often hidden. Masturbation done mindfully can be a lifeline, not a vice, not a leftover habit, but an active, vital part of emotional, physical, and even spiritual well-being. Let's break it down. As you age, your body changes. Circulation slows, nerve sensitivity dulls, hormone levels drop. But here's the thing, no one tells you. Regular intentional masturbation can counteract all of that. It keeps blood flowing through the pelvic region, stimulates nerve endings, and helps maintain the elasticity of sexual tissue. It also clears fluids from the prostate, reducing the risk of inflammation and stagnation. And that's just the physical side. Emotionally, the impact is just as profound. Masturbation, especially for men living alone, can be a daily reconnection ritual, a reminder you are still alive. You are still deserving of pleasure. You are still whole. Walter, like many men his age, had stopped. Not because he didn't want to, but because he felt it wasn't appropriate. He believed the chapter was closed. That intimacy was for younger men. That desire had an expiration date. But he was wrong, and so are the millions of men who've internalized the same belief. When Walter gave himself permission to explore again gently without shame, something beautiful happened. He smiled more. He slept better. He reconnected with memories, sensations, confidence, not because he chased youth, but because he reclaimed dignity. This is what most people don't understand. Masturbation at this stage of life isn't about lust, it's about presence. It's about agency. It's about saying, I still matter. Now, some may ask, isn't it too late? No. It's never too late to reconnect with yourself. Whether you've gone months, years, even decades without it, your body is still listening. Your nervous system is still capable of joy. Your spirit is still seeking intimacy, even if it's just with yourself. But here's the key, not just any masturbation. We're not talking about rushing through it out of boredom or habit. We're talking about slowing down, being present, breathing, touching with intention, not performance. This isn't about finishing, it's about feeling. This is where the magic happens, when the act becomes less about release and more about reconnection with your body, your memories, your sense of being alive. I've seen it over and over again in my practice. Men in their 60s, 70s, even 80s, rediscovering something they thought they had lost forever. Not youth, but aliveness. Not performance, but peace. So if no one has ever said this to you before, let me be the first. You are allowed to feel. You are allowed to touch. You are allowed to care for yourself in this way. Masturbation isn't your enemy. In old age, it can be your ally, a lifeline, a compass, a quiet act of rebellion against the narrative that says, older men must stop feeling. And now that you know this final truth, this last secret, ask yourself, what else have I been told to give up? That I still deserve to keep, because your story isn't over. And neither is your right to feel deeply, live fully, and age with dignity. Life doesn't stop when the body slows down, and neither should self-connection. One of the most powerful lessons from these 5 masturbation truths is this: aging isn't the end of desire, it's the beginning of a different kind of relationship with your body. In a culture that equates masculinity with performance, many older men are left in silence, shame, or confusion when their bodies begin to change. But the truth is, your value, vitality, and intimacy do not expire with age. Whether you're single, widowed, or partnered, your body still deserves attention. Your emotions still deserve validation. Masturbation, when done with awareness and intention, is not about lust, it's about self-care, circulation, hormonal balance, and staying connected to your identity. The biggest takeaway: presence beats performance. Emotional clarity beats shame. And consistent self-connection can be a lifeline not just for sexual health, but for your mental, emotional, and physical well-being. You are not broken. You are evolving, and you deserve to live and feel fully. This isn't about reclaiming youth. It's about reclaiming yourself. So start today, quietly, gently, without shame, because the most powerful intimacy you can rebuild is the one with yourself. If this message spoke to you, even just a little, don't keep it to yourself. Drop a comment below and let me know which truth hit home for you. Save this video so you can come back whenever you need a reminder that your health and pleasure still matter. And if you're ready to reclaim your body, your confidence, and your connection, hit that subscribe button and turn on the bell. I'm here with honest, age-specific advice made just for men like you. Let's build a space where you're not alone, because your story is still being written.